palate is going to be where you're going to have bone. And so it's going to be very hard to push in. You're going to have these ridges. That's going to have some rugae and kind of taste buds there. The soft palate is way back here, and I'm pushing in on the soft palate, and that's actually going up towards into the nasal cavity. The big thing with the mouth is the epiglottis. I definitely will have that identified. So the epiglottis is this big flap, right? And then it's kind of hard, but I'll have it better shown on the test, is the vertical slit is that glottis. The glottis is going to be the opening to the trachea. And so every time you swallow, that flap, that epiglottis is going to go over the glottis, epi sitting upon, all right? So it covers up the glottis so nothing goes down in the trachea. Then there is this horizontal slit behind the trachea. That's going to lead to the esophagus, okay? So the esophagus is definitely going to be identified lower, not way back here, because it's really hard to get a pin and stuff like that, all right? So hard palate, soft palate, epiglottis, glottis is going to be the opening to the trachea, which is a vertical slit, and then the esophagus is going to be the horizontal, and the opening is called the gullet, okay? And it really doesn't say that, but I am telling you that. We're gonna go ahead and I'll go right here. So this needs to, but the muscle needs to be separated. But this thing right here with all the rings is going to be the trachea. Okay? And then right here in this area is going to be the larynx. The larynx is where the voice box is going to be. And it's much thicker. And you can feel it right here, and it has a lot more cartilage. So the larynx is right there in the throat area, and that's going to be where the vocal cords are going to be. Then you go underneath the trachea, and you come here, and teasing some of this tissue away. Directly behind the trachea is this tube. The tube is going to be the esophagus. The esophagus is all soft tissue, whereas the trachea has the cartilage, so it's a little tougher, and that's why this sits in front. Keeps it open and kind of protects the soft tissue. So then this is the esophagus. That's going to lie right underneath the trachea. Okay? Now we're going to come here into the abdominal cavity, where you had to go next in your book. This big muscle right here that's going to separate your abdominal cavities from your thoracic cavity is the diaphragm. I will definitely ask this question. There are only 3 vessels that pass through the diaphragm. What are they? Okay, so the 3 vessels that pass through the diaphragm are going to be, and it's really hard to see, but one of them is going to be the esophagus. Okay, so here's your esophagus, and it's really hard to see that up above here, but there is the esophagus right there. The other one is going to be the inferior vena cava, which is right here, which kind of you can't see as well because we cut it from getting the heart out. Okay? And the other one way back here, all the way behind, is the descending aorta, which the descending aorta is going to be carrying all oxygenated blood to the lower part of the body. So that's going to be an artery. So the 3 vessels that pass through the diaphragm are the esophagus, inferior vena cava, which is bringing all deoxygenated blood from the lower part of the body back to the heart, and down here, it's really, you can't even see it, is the descending aorta, which is taking all oxygenated blood to the lower part of the body.
Will that be pinned, or
It will not be pinned, it will be asking questions, okay? I will ask questions. It's very hard for me to get to all of that, but I will definitely ask those questions.
Got it.
Okay, so then you come here and you have the liver, all right, and you actually, there are 5 lobes to the liver in the cat, 1, 2, 3, and in this top lobe, that's the 3rd lobe, is going to be the gallbladder, which is the sac that's going to store bile, and then you come back here, and the 4th and the 5th ones are very minor, but they're very deep. Okay, they're actually posterior to everything else. So 5 lobes to the liver. For the cat, we only have 4. Good question. Not like a pin, like which lobe is this? I will have a pin in this and you'll say, hey, this is the liver. That's all you need to know. But I'll ask like lobes and things like that, like I had you highlight in the book. Okay? So underneath the liver is going to be the stomach. Okay, the stomach actually starts on the left-hand side, J shapes around, all right, and comes over here to the right side. But remember the different parts of the stomach. You are going to have the fundus, which is way up above. You're going to have the cardiac, which the esophagus dumps into. You're going to have the body, which is the main area of the stomach. And then you're going to have the pyloric region, which is going to constrict down. It's going to get smaller, leading to the small intestine. Okay? And questions like, what are the ridges on the inside of the stomach called? That's going to be the rugae. But you guys can see when you open up this stomach, look at that nice roundness to that. That's going to be the pyloric region, and then the pyloric sphincter is going to be all the way down here where the stomach attaches to the duodenum. Will there be a pin? Most likely not. Will there be a question? Yes. Okay? So now the question is that I always get, well, how am I supposed to know which part of the small intestine is? Because you're not just going to do small intestine. It's going to be duodenum, jejunum, and ileum. So I can tell you this much. Here's what's going to happen. The duodenum actually is going to be deep to everything else, even the ascending colon, okay, and transverse colon. So as soon as the stomach ends, you start the duodenum. The duodenum right here is going to be the straight part of the small intestine. So if it's all the way over on the right-hand side of the cat, not your right-hand side, but the right-hand side of the cat, and I have a pin way down here, then you're going to say that's the duodenum. Then you're going to get all this curlicue stuff, and I'm going to have a pin right here, and you're going to say that's the jejunum. Then, is there an actual spot exactly? This is where the jejunum ends, and no, there's not. You can tell internally, but I won't have that. But what I will have is when I go here, and I'm going to go through the whole small intestine, but here's what's going to happen. I'm going to move it out of the way, okay, and the ileum is right here, and it's going to be attached to the large intestine. So if I have a pin in the lower small intestine, you're going to hopefully know that's the ileum. So I will have a pin like right here next to where it attaches to the large intestine. So then you start your large intestine. All right, I'm going to move this all out of the way. Okay, so here's the ileum. Here's the cecum, which is going to be that little pouch that sits underneath the ileum. You're going to come up here. The ascending colon goes up. The transverse colon goes across, and I've removed all the small intestines so you can see it, and that will happen in tomorrow's test too. And then the descending colon comes down, and the descending colon is the longest part of the colon. Okay, so the ascending colon is on the right-hand side, the descending colon is on the left-hand side of the cat's. Again, the cat's left and right, not yours. Okay? And then you go, and don't worry about the whole concept of the rectum and things like that. I'm not worried about that. So that's all intestines. So you come down here and you have the bladder. Some of you guys as cats, the bladder was much larger than others. It just depends on how stretched out it was when it died. Okay, but all around the bladder has all these fat pads. Everybody had that. All right, but it's just a protection because look, it's right there. It sits right there. You got to have a little bit of protection. So the bladder is right here. All right. So I'm going to stay in the abdominal area just because then it will be easier when I go up to the chest. So it all stays in one area. So this thing all the way on the left-hand side, theirs is very, very large, and it's a dark red. Some of you guys, this was a very, very pale color. But this is the spleen.
Kaylee's is huge.
All right. And I did ask a question, or I did have you highlight this in the book. Relative to humans, the cat spleen is much larger than humans. Much larger. Okay, so this is the spleen. Underneath the stomach, actually, if we look, attached to the spleen is going to be a very thin lobular gland, and this is all the pancreas. So you have to lift up the stomach to see the pancreas, and it's all in all of this mesentery, and it goes all the way. If you look, it continues on into the first line of the duodenum. Okay, so the pancreas is attached here at the spleen, goes all the way across underneath the stomach and on the first inside curve of the duodenum. But it's very thin, and for most of you guys, this is such a clean cat, but theirs is very easy to see because of how white it is and there's no blood there. Okay, now coming over here, these structures that you had to take off and remove the capsule, which we didn't do on this cat, but that is going to be the kidney. Okay, so that right there, and then this is the other kidney, and again, it depends on what cat I use, if it's the right or left, but all the way in the back is the kidney. Okay, this is a female cat, so here are your oviducts, or what we call fallopian tubes. This little peanut-shaped structure, that's the ovaries. Okay, so you have them on both sides. And then when they unite, which sits underneath the bladder, where they come together, that's going to be the uterus. And again, remember, why can they carry litters and we can't? Because their babies develop in these, the uterine horns or fallopian tubes or oviducts, and not the uterus. But ours has to actually develop in the uterus. If it happens here, we're in trouble. Go ahead and take a break. But I'm picking up. See how it's attached right here at the kidney. And it's going all the way underneath all of this fat, but it leads through all of this fat right to the bladder. So these are known as the ureters. Be very careful on the cat when I have this identified, because what is it next to? It's next to the fallopian tubes. But I will have that moved away, and I will have this pinned and make sure it goes all the way to the kidney. Then that will be the ureters. The ureters are carrying urine from the kidneys to the bladder. Then, again, turn it off because I need to